This is Health and Wellness. We're talking about life after COVID today. And as we've heard, there are myriad long-term complications as a result of COVID-19. Some people suffer from fatigue, joint pains, loss of taste and smell. But what really happens to the body when we're recovering from this virus after being given the all clear? Let's chat further about this now with Dr. Daniel Israel. Doc, a very good morning to you and thanks for your time. You've seen a lot of patients, we understand, post-COVID. What are the common battles or challenges that they're experiencing afterwards, after being given the all clear?
So, Uveka, firstly, it's important to understand that most patients do get better from COVID in a relatively short time. So, at the beginning, we saw COVID only as a viral infection that lasted for 2 weeks, and that was the end of it. But I must say that in my own experience as a doctor in our practice and amongst the medical literature, we are seeing more and more people who present with a prodromal post-viral syndrome with COVID. Some studies overseas show up to between 10 and 30%, depending on which study. Patients are, as you said, complaining of shortness of breath, increased heart rate, known as a tachycardia, intolerance to exercise, headache and brain fog. Those are the main ones. So we are seeing that in our practice. In
terms of the actual serious damage then, I mean, just looking at experiences around the world, Doc, I mean, we're looking at organ damage caused by COVID-19. Later on in the show, we've got somebody who had a lung transplant, a young mum. What have you seen? Is it just the lungs that we see that are damaged? What other organs could potentially be damaged that would also feature or make recovery all the more difficult?
So, Uveka, COVID was initially thought just to be a respiratory illness, and we've seen that as we've uncovered more and more information that it's actually a pro-inflammatory illness that affects many organs, as you said. Remember, COVID enters the cells through the ACE receptors, those receptors on cells, and those cells are very populous in the lungs, but they also are present in other organs like liver, kidneys and various organs in the body. On a clinical perspective, so we know that there's risks of clots in COVID at the time initially, but we've also seen that after COVID there is thought to be a subclinical inflammatory phase that people go through. Now, Uveka, the difficult thing about this is that for many of the patients who we've seen who get long COVID, so to speak, when you do their blood tests, you find that their bloods are normal. So it becomes a very frustrating place for patients to be in, where they certainly don't feel normal, and they may be a healthy young athlete who's used to being able to do a lot of efforts and at the moment can't do anything, and yet when they go to the doctor and are examined and do blood tests, everything looks fine. And then that starts knocking on the doors like of ME and chronic fatigue syndrome and those type of diagnoses. So this is the overall picture we're seeing. You won't measure the damage in the organs, but we certainly believe theoretically that there is inflammation in the organs for quite some time in patients.
So let's talk about those other things that we've had people experience, things like losing taste, smell as well. A lot of them say also that they battle with memory, Doc. They can't remember things. Their memory is sort of shaky as well. I mean, we know the chest pains, the fatigue, all of that comes. But what happens then? I mean, how long does it take? Will they ever get those things back? Taste and smell. I mean, it's the best diet you could ever be on, some people will say. But, I mean, you want to taste your favorite things. You want to smell your favorite flower, and you want to remember things. So how long does it take? Does it come back, or is there a time frame for it?
So you have to remember that the loss of taste and smell are from damage to the nerve, damage to the olfactory nerve, and all nerve recovery takes a long time. I mean, anyone who's listening to the show who would have had a neurological damage before will know that a nerve grows at a very, very slow rate, less than a millimeter a year. So unfortunately, we don't have anybody in the world who got COVID 2 or 3 years ago. But so we can draw the data from that. But as a whole, the patients who have lost their smell, for example, and it's gone on for some time, have got their smell back. So we do believe at the moment that it recovers, but it can take a lot longer than the initial symptoms. There are other parts of COVID, though, of long COVID, that really can go on for some time besides taste and smell.
Well, tell us about that. What are those?
So I mean, what we're finding is that we're finding that fatigue and brain fog are probably the most common symptoms that patients are complaining about. I find that in my own practice, patients who complain of what we call postural orthostatic tachycardia, which means as they get up and exert themselves, their heart rate just goes through the roof. Even a fit, healthy patient is a common phenomenon we see after COVID. We also see that this fatigue is a big story. Patients are unfortunately grappling with the need to involve themselves in their normal daily activities of jobs and parenting, and while they are suffering fatigue that really there's no quick fix to. And those can go on for months after COVID. And the studies in the US and the UK have shown that when patients report their signs and symptoms, that even 8, 10, 12 months after COVID, some of them are still very affected in these ways.
So have you seen a lot of patients, or have you seen any who've had a second COVID infection? And then what happens there if somebody is infected twice? What are the dangers? Is there then the potential now for long-term permanent damage?
So as it is with other viral infections, each COVID infection would be another insult on the body. I've seen myself reinfections. They're not that common, but they are there. And particularly with the change of variants, when you get a new variant that has slightly altered shape, let's call it in layman terms, for the immune system, there is that risk of reinfection. But it's not a question of every time someone gets reinfected with COVID that they're going to become sicker and sicker. That certainly isn't the case. Those are my experiences.
All right. Doc, how do you advise your patients, or those in recovery, as to, especially those who are active and are used to being active and just can't sit around doing nothing now? When do you say to them, okay, this is how you could possibly get back to your health and fitness goals? What is the marker for that?
Okay, so let's remember that initially the COVID infection lasts for 14 days. So or 10 days in, once they're out of the 10-day initial period, they're no longer infectious, even if they still have symptoms. The important thing, though, I really believe, is that beyond that point, it's about easing oneself back into normal life. And even the studies internationally have shown, and there was a recent paper in the South African Medical Journal by some of our professors, that taking on a limited lifestyle at the beginning will actually land up with a quicker return to normal life than going full ahead. So I was speaking to a teacher yesterday, and I told her that she should take on part-time for the first week or two to see whether she's coping. We really believe that if you push yourself too hard from the beginning, you don't give your body the time for that inflammatory respite and convalescence, and that really pushes patients more into it. So it's about adequate rest, it's about good hydration, it's about mental health. Remember that the hardest thing about feeling tired is this awareness that you're feeling so different to how you used to, and when will it end, and will it ever end? And that positive speak and support from other people makes a very big difference. Unfortunately, the studies have not shown yet that there's any miracle cure medically that we can give to make this post-fatigue syndrome go away. They are looking at really interesting things, like statins, which are cholesterol medication for that. But there is a report out of the US, a study being done, where patients who have received the vaccine, in fact, have showed marked improvements in terms of their fatigue after COVID. Okay. And that I certainly believe is going to be a way in the future. Okay, so it does help, even if you do get it, then that it would contribute to your recovery afterwards, getting that vaccine. We believe so. What data will show that we do believe so. All right, and just in a nutshell, just a few seconds, Doc, I think we need to remind people of how to live their best lives, how to take care of themselves so that they don't stand a chance of getting COVID-19. We know it's possible for everybody, but I think everyone needs a reminder as we live in fear of this third wave now. So, Uveka, I recently wrote an article about how I really believe that if you swing to one direction or the other in the face of COVID-19 pandemic, you're doing yourself danger. If you live your life and you say, I'm going to avoid all risk at all costs, the problem is that inevitably mental ill health comes in, isolation, depression, kids grow up with lacking social skills. This is a big problem. On the other hand, I see a very big cohort of patients who kind of feel COVID's over, this is just the flu, and they still have that mindset, and let's carry on. And that also is a problem. So really one needs to do one's own risk assessments and say, look, I'm a higher risk patient, let's say, and I need to be very, very cautious in terms of exposure to people. The normal things that we always go on about: mask wearing, sanitizing, social distancing, but still be plugged into the real world, because this can go on for months until we've developed a population immunity.